Hello, everyone. So thank you for joining this webinar on the Wellcome Data Prize for Mental Health. So I'll quickly introduce myself before talking through the agenda. So I'm Juliette Néron, and I'm the project manager at Social Finance for the Data Prize, and I'll be chairing the webinar. So for those who haven't heard of Social Finance before, we're a non-for-profit organization, and we partner with organizations and communities to develop solutions for lasting social change in the UK and globally. So our teams at Social Finance brings together expertise in data science, product development, user research, co-production and strategy across the health, social and public sectors. So now to walk us through the agenda, first, I'll be handing it over to our colleagues at the Wellcome Trust to give an introduction to the data prize and data prices in general, as well as an overview of their work on active ingredients, which is really at the core of the analysis that our participants will be undertaking. And following that, we'll go into more detail about the data prize in mental health, so notably including what we are looking for from participants, how the prize is structured across the different phases, and then my colleague Michael will then run us through some examples of use cases that will be in scope for the prize. So here, by use cases, it refers to the combination of the research question and the digital output that a team will be focusing on to support future research into mental health. So we'll then have some time at the end for questions that people may have regarding use cases or the data price in general. And in terms of housekeeping, so we'll be recording this session just so that everyone is aware, so that we can make the recording available to those who are unable to make it to the webinar. And if you have any questions, you can raise them as they come up in the Q&A functionality. So you should have a button at the bottom of your screen. And my colleague Rosanna will either flag it for us to answer in the Q&A session at the end, or we will also look to answer straight away in the chat Q&A function. And if there are any questions that might need more in-depth answer, we'll also look to pick this up and provide more information about them following the call. So I'll now hand it over to Ekin from the Wellcome Trust.
Thank you, Juliette. Hi, everyone. So my name is Ekin Burukbaşı, and I'm the Data Prizes Manager in Data for Science and Health team at Wellcome. Firstly, thanks a lot for joining us for this webinar today. We've been working towards the launch of this Mental Health Data Prize for over a year now, and so we are really very excited that it's finally happened and we were able to open up for applications earlier this week. And of course, I'm also very, very excited about what we'll be able to achieve together as part of this Mental Health Data Prize community. So I thought that as a member of data team at Wellcome, I'd start by giving you a bit of a background on how we relate to the rest of the organization. And then we can perhaps go into more details, into a more in-depth conversation about the Mental Health Data Prize itself. As you know, or as you may know, over a year ago, Wellcome has launched its new strategy, which is to support science to solve the urgent health challenges facing everyone. And as part of this vision, we'll support discovery research into health, life, and well-being. And we'll also aim to solve 3 worldwide health challenges. So these are mental health, climate and health, and infectious diseases. So as Data for Science and Health team, we have a cross-cutting function across discovery, research, and these 3 health challenge areas. And simply put, we want to see trustworthy data science transform how science solves health challenges and makes discoveries. And Wellcome Data Prizes program is a new approach and an adventure for us. And this one, the Mental Health Data Prize, is the first one of the series. So while we were designing Wellcome Data Prizes, we thought hard about what was important to us and decided on some high-level principles. So firstly, we decided that we'll reach out beyond usual networks because we think that solving urgent health problems requires the right skills, experience, and also it requires different perspectives. Yeah, we are aware that most of the research on health happens within established research communities and disciplines, and we really want to change that. Secondly, we want to put involvement at the heart of our approach and the design of Data Prizes program. We'll value lived experience and partner with the communities we are working with throughout the Data Prize and at different stages. And finally, we really want to raise awareness around the health challenge we are focusing on and inspire solutions. So we are committed to talk about our work openly and share our learnings, success stories, but also the challenges that we may encounter throughout this journey. We really want to increase the public awareness of the problem we are interested in and hopefully inspire people about possible digital approaches to address them. So with our partner, Social Finance, over the past year, we've engaged with mental health researchers, data holders, ethicists, and also young people with lived experience of anxiety and depression. And through many workshops, meetings, and webinars like this one, we tried to understand their various priorities, and we heard their ideas about how research and digital tools could make a difference to youth anxiety and depression in the UK and South Africa. So with this background in mind, the question that we want to answer here as part of this Mental Health Data Prize is what prevents, treats, and helps to manage anxiety and depression in young people in the UK and South Africa. And to answer this, we want to bring together multidisciplinary teams to explore what insights can be drawn from existing data sources and what tools can be built to better support research into this field. So I'm going to stop here and hand it over to my colleague from the Mental Health Challenge Area team, Kat Sebastian.
Thanks, Ekin. Hi, everyone. I'm delighted to be here today. I'm Kat Sebastian, head of the evidence team for mental health at Wellcome. And I'm going to start by talking a little bit about the mental health strategy and how that feeds into the Data Prize. And then I will also talk in more detail about our active ingredients program of work, which forms the basis of the research questions that we will be asking people to focus on for the Data Prize. So our vision in mental health at Wellcome is a world in which no one is held back by mental health problems. And we recognise that this is a global problem. So mental health problems are holding people back in all parts of the world. And such problems are set to become the largest burden of the disease over the next decade or so. At Wellcome, we firmly believe that science and mental health research has a vital part to play in finding new solutions. But equally, we recognise that mental health is highly complex. It's a tangle of biological, psychological, and social factors that won't be resolved by pulling on any single thread. So the solution isn't going to be just pharmacological, it isn't going to be just social, it's going to be a tangle of solutions, just as mental health problems arise from a tangle of the biological, psychological, and social. In terms of the type of mental health science that we want to fund, we're focused in the first instance on anxiety, depression, and psychosis, although the Data Prize focuses particularly on anxiety and depression in youth. And we're interested in intervening as early as we possibly can. To do this, we think it's important to understand how brain, body, and environment interact, both in the development of mental health problems in the first place, but also in understanding how they resolve and how interventions work. As part of that, we're interested in active ingredients, which I'll talk about more on the next slide. But essentially, we're interested in unpicking the complexity of what's responsible for positive outcomes in mental health. And we're also interested in research that helps us to understand more about how to personalize interventions to prevent, manage, and solve mental health problems. In addition to the research that we would like to fund directly, we also think that it's important to enable that research in a number of ways. And we can do that, we think, by building the mental health science community, bringing together multidisciplinary teams, researchers, clinicians, those with lived experience, people working across the range of disciplines involved in mental health science. And we'll hear more about multidisciplinary aspects of the teams for the Data Prize later on. And we're also interested in measurement. So can we support the agreement of some common ways to measure mental health outcomes so that we can better harmonize data across data sets? And finally, how can we support the demand for this research in the wider community? So, for example, with policymakers and thought leaders. Next slide, please. So now that I've given a broad overview of our mental health strategy, I'm going to focus in on what we've been terming active ingredients. This work has stemmed from the realization that although there is a very wide range of treatments and prevention initiatives available for mental health problems such as anxiety and depression, there's actually been limited improvement in terms of outcomes over the past few decades. And we wanted to understand better what approaches work and, importantly, why they work. So we started this program of work focused on understanding what works for whom, in what context, and why. So recognizing that there's not going to be a one-size-fits-all solution when it comes to youth anxiety and depression. We've been working on this concept of active ingredients, and we see this as the aspects of an intervention that drive clinical effect, are well-defined and linked to specific hypothesized mechanisms of action. And by focusing in on these tightly defined concepts, we hope to better be able to understand what's effective and how that might vary depending on different contexts. So since 2020, we've been funding reviews into these active ingredients. And we've taken a very interdisciplinary approach and we've focused very broadly. So we've asked teams to look at ingredients that may be biological. So for example, how SSRI medications might be working or how circadian rhythms interventions might work, right through to cognitive behavioral therapy elements, such as exposure or emotion regulation, right through to ingredients that might have more of a structural solution. So for example, improving urban access to green space or cash transfer initiatives. So we've really taken a broad approach from the cellular to societal, and we've been reviewing the evidence on what works for whom and why. However, we've realized that there are significant gaps in the literature, particularly as regards youth. And so part of what we want to learn from the data prize is what can we gain from longitudinal data in terms of understanding more about what's helping. There's a lot of focus on causes of symptoms of anxiety and depression in the first place, but what can we learn about how these problems resolve and how specific active ingredients may be causal to that process. So with that, I will pass, I think, back to Juliet for more information about the prize.
Thank you, Catherine. So now I'll give an overview of the Wellcome Data Prize in mental health. So first, in terms of objectives, so the Wellcome Data Prize in mental health aims to support multidisciplinary teams to analyze existing data sets and develop new digital tools for the mental health research community in order to help understand what works in addressing anxiety and/or depression in young people below 30. So throughout the prize, teams will be focusing on use cases, on the overall theme of active ingredients. So as mentioned earlier, use cases here are the combination of a clearly defined research question and a digital tool that will aim to facilitate further research into depression and/or anxiety in young people. In order to explore their use cases, team will be analyzing existing data sets that will need to fit some specific criteria in order to be eligible for the prize. So all the criteria are on the Wellcome website, but I'm just going to highlight them quickly now. So first, the data should be longitudinal with a minimum of 3 waves of observations. The cohort should be children and young people below the age of 30 from the UK or South Africa. Data sets must include data from at least one age-appropriate measure of depression and/or anxiety. And finally, the teams should have been given access to the data from the data holders before the prize application deadline. So all of these, so it's not on the slide, but it's all outlined on the Wellcome website. We are, in terms of data set, we are proposing a selection of data sets that match these criteria and for which candidates can request access. And the list of all the data sets that we are suggesting, so that's data set from the UK and data sets from South Africa, are outlined on the website, along with a clear process regarding how to request the access for these data sets. And teams can also bring their own data set, but it has to match the criteria, the eligibility criteria for the data sets. In terms of who can apply to the prize now, so you also have all of that outlined on the website, but some of the criteria to highlight are that, so the lead applicant of each team must be based in the UK or in South Africa. And he or she must be based at an eligible host organization that can sign up to the Wellcome grant conditions. In terms of organization for the lead applicants, this should be either a higher education institution, a research institute, a non-academic healthcare organization, or a not-for-profit organization. The scope of eligibility for the co-applicants is broader in order to allow for the breadth of multidisciplinary teams. And notably, the co-applicants, they don't have to be based in the UK or South Africa as long as the lead applicant is. And in terms of host organization, it can also include like commercial organization or freelancers. For instance, if you're, I don't know, like a data scientist and you're on your own freelance or on your own account, that's possible. And lastly, like in terms of evaluation criteria for the team to be evaluated, so teams will be screened on eligibility, feasibility, so whether the project they want to carry on is really feasible, and ethics, and so that this will be a prerequisite for selection. And in terms of feasibility, the assessment will include the assessment of the data access. So can the team really access the data that they are looking to access? What's the data strategy? What's the research methodology? And does the team have the appropriate resource and experience to carry the work as well? Once the application have passed the screening, so this first screening, they will receive a score, both for impact and innovation on each of the 3 dimensions, so the research question, the approach to tool development, and team involvement. So now I'm going to explain a bit more about the structure of the data prize. So there are 3 phases to the prize, and each of these are 6 months long and with different levels of funding and support on offer for each of them. And only a subset of team from each phase will be progressing to the next phase. So in July, an initial 10 teams will be selected for the discovery phase, so that's the first phase, and each team will receive £40,000 of funding to undertake their work. So during this phase, participants will be undertaking the research on active ingredients and mental health, and they will be exploring what works for young people and using the core data set we have selected. So that's a phase which is more focused around the research question, but participants will also use this phase to start ideating on their digital tool in preparation for the prototyping phase. So after the first 6 months, 5 teams will then make it to the prototyping phase, and they will receive an additional £100,000 per team. And during this phase, team will focus on the tools, the digital tool. So they will focus on creating a prototype of their digital tool, and they will also refine and disseminate their research that they have been working on from the discovery phase. Finally, so after the end of this phase, there will be 3 winning teams that will receive a share of £500,000 of funding. and they will also receive further support for the scaling of the tool over a period of 6 months. And finally, so throughout these 3 phases, teams will be supported with data access, use case development, support on how they can plan to involve a lived experience approach as well. So that's going to be ongoing through the different phase. And I'll now hand it over to Michael, who will run over some examples of use cases that will be in scope for application to give you a better idea.
Thanks, Juliet. Hi, everyone. My name is Michael Hanks, and I'm a data scientist at Social Finance. And what I want to take you through today is just a few bits of guidance around the kinds of use cases that we anticipate being in scope for the prize. So as my colleagues have already said, the use case in this instance means a research question and a digital tool. And really what I want to do here is provide some illustrative examples that show sort of what do we mean by these two things going together. How might they go together? How closely related might they be to one another? And also show how the research questions should be framed in terms of this what works approach, the active ingredients framing of research questions. Could I have the next slide, please, Juliet?
Yeah.
So you can see from this slide that based on our sort of initial thinking on this, we envision that most of the tools that teams will produce will fall into one of these categories. So in the first instance, there might be tools that enable people to perform data analysis in mental health research. They might be tools that enable people to replicate analysis that has already been conducted. They could be tools which enable the sharing of insights from research into mental health more widely. And they could also be tools that facilitate data analysis. So rather than necessarily performing it, they might just aid in the sort of construct of a data analysis. And what I'd like to do now is basically take you through an example use case, which comprises in each case of a research question and a digital tool, where each of the digital tools will fall into one of these categories. Naturally, we're not intending this to be like completely exhaustive. We recognize that there probably are lots of very good proposals that will sit outside this sort of rubric that we've constructed, and we absolutely welcome people to propose other tools. I'm sure that a lot of the tools that get put forward will be a lot more ambitious and interesting than anything that I've managed to make up here. So I'll just go through these 4 examples, and hopefully they'll give everybody a sort of flavour of the sorts of things that we're talking about. So in this first one, this is an example of a use case that has a tool that would perform data analysis. So in this case, the research question has a cohort defined, a South African cohort defined, so young people who've left school in South Africa. The active ingredients that are being referred to are like a broad range of active ingredients. So it's not focusing on any particular one, but it's actually looking at combinations of active ingredients and those combinations which provide resilience against depression for this cohort of young people, which would be assessed by analysis in a longitudinal data set. And the tool that might enable someone to carry out this research could well be the kind of tool that we're putting forward as the example, which in this case is using like a statistical software package. I've put R here, but it could be any number of statistical software packages. And the tool itself is some sort of statistical analysis tool that performs cluster analysis on longitudinal data sets to sort of group children and young people who have similar profiles for the impacts of these combinations of active ingredients. So in this case, you can see that the use case, the tool actually relates quite strongly to the research question. In fact, it's probably a tool that the team doing that research question would have developed in order to answer that. But the use case would be both the outputs of the research itself and also the tool made available to the community for future uses. Could I have the next slide, please, Juliet? So the second use case is one that's where the tool would be something that enables people to replicate data analysis. In this case, you can see that the research question has a UK cohort, just broadly defined as in a UK cohort. The active ingredient is quite specific here. It's talking about spiritual beliefs and practices and how they might aid prevention and treatment of anxiety in that cohort. And the example tool is perhaps not something which is so closely related to answering the research question specifically, but is something that might be useful across many different research questions in mental health. It's something that would enable the generation of anonymized or synthetic data sets from a longitudinal data set that enables the maintenance of the data structure, but allows for a much more widespread sharing of, say, the types of analysis that could be performed on that. So really a tool that allows the replication of data analysis on potentially quite sensitive data across more widely in the community. And in this case, we're saying again that this would be created perhaps in Python in this instance, but I'm sure you can imagine that it could be created in lots of different formats. Could I have the next slide, please, Julia? So the third type of use case that we've talked about is one that might allow more widely the sharing of insights from data analysis and from mental health research. So the example research question in this case, looking at South African cohorts and in fact looking across multiple studies. So this would be a research into how the active ingredient in this case, increased household income, could provide a protective effect on teen depression and anxiety across 2 different cohorts, so across 2 different longitudinal data sets. And the example here again is perhaps more tangentially related to answering that particular research question, but refers to a tool that would be useful for comparing the results of analysis or the results of research from multiple different studies. So in this case, it's looking at a co-produced online database with some sort of co-production managed in a sharing software like Git, which would allow the aggregation of research outputs related to active ingredients in children and young people from multiple research outputs into one place, which would allow users to filter by things like age or active ingredient geography, to drill down into the comparisons of the effects of different that have been detected across different analyses. So quite a different type of use case to the ones we've seen before, but definitely in scope for the prize. Could I have the next slide, please? And finally, we've got use cases that facilitate data analysis rather than necessarily performing them. In this case, we've got a research question looking at a UK cohort, again, school-age children in the UK, and looking at quite a specific active ingredient, in this case, access to green space, and the protective effect that might have for children in the UK against developing symptoms of anxiety. This research question, in order to be able to perform this analysis, it might well be required that a longitudinal data set needed to be matched against other data sets in order to assess that access to green space for the subjects in that longitudinal study. So in that case, the sort of tool that might facilitate that kind of a data analysis is one that would allow the matching of data sets to publicly available data sets, such as perhaps publicly available Ordnance Survey databases that might contain exactly this kind of data on access to green space. So in this case, the example tool we're proposing might be some sort of browser-based data science tool that formatted geographical identifiers in the longitudinal data set into the kinds of geocodes that could be linked to Ordnance Survey databases, and then perhaps might even provide an interface for doing that joining of publicly available data onto the geographical data from a longitudinal data set. So clearly quite related to the research question. It's the kind of tool that might be required to carry out that research question, but not necessarily related to green space. It could have quite wide applications beyond the specific research question. Could I have the next slide, please? In fact, I think that's the end of my slides. So we're just going to the Q&A now. I hope that's been helpful. Again, just to reiterate that this isn't intended to be completely exhaustive in terms of the breadth of examples that could be proposed. Definitely happy to take Q&A around those research ideas, but hopefully that provides some illustration of the kinds of use cases that we consider to be in scope. And thanks very much.
Thank you, Michael. So yeah, as Michael was saying, we're now going to open it up to questions. So feel free to pop up your questions either in the chat or in the Q&A chat next to it, or you can also raise your hand as well. And my colleague Rosanna is going to be able to bring your questions to the panel.
Brilliant. Thanks so much, Juliet. And we've got a couple here to kick off. So actually just seeing the one in the chat now, Antonio, yes, we'll be making the recording available. So we are currently recording the session and we'll be posting that up on the webpage. And I think Romana has shared a link, but it will also make sure that we email that out to people in case anyone hasn't been able to see the slot now. Picking up on some of the questions that have come through on the chat. So I'll start with the first one from Daria, saying if the data are free to access via the UK data service, for example, next steps, is any proof for access still required for the application? I might pass that over to Michael if you're happy to pick up on that one.
Yes, absolutely. So yeah, understand that in the UK data service, some of the a lot of the data for data sets like next steps are available just under the end user license. If the research can be carried out without access to any of the fields that sit in the more secure areas of the UK data service, then I think all that would need to be demonstrated in the proposal was that the sort of publicly available data was sufficient to address the research question, and then maybe just upload the end user license as proof that yes, we can accept this end user license. That's the only barrier to entry basically to accessing data that's required. That's absolutely fine.
Great, thank you so much, Michael. And I might group another one on the data side together. So there's also a question saying if a team brings in their own data for the Wellcome Data Prize, what level of data sharing is required?
So I can pick this on up again. I think the level of data sharing obviously is quite an interesting question to answer in terms of we understand that a lot of these data sets have a lot of personally sensitive data and that can't be shared. I think that the minimum level of data sharing that would be required is that if any digital tools are produced or any research is produced that uses this data, that sort of sufficient data would be shared that would enable people to replicate the analysis or the findings, or to replicate the type of research that had been done on that data set, whether that would be by like pseudonymizing or reducing the level of data but maintaining the structure of the data set. It would be that kind of sharing, I believe. I don't know if anybody else also wants to pick up on that point.
Hopefully that's good, but I can see there are a few more questions coming in the chat, so we can continue to plow through those. The next one is a slightly different one. So one asking, is there a specific rationale for focusing on the UK and South Africa? Are you expecting secondary data analyses to be on both countries, or would it be possible to focus only on one country? I might pass over to Ekin to kick off on that one.
Sure. Okay, so thank you for this question. So as I mentioned, this is a new funding model for us. So instead of using data globally from anywhere and everywhere, we thought it would make sense to focus on a smaller subsection of the countries to start with. And we definitely wanted to have data sources from the global north as well as from the global south. So given our connections, like starting with the UK made sense for the global north. And also, since mental health team has already some complementary work going on relating to mental health data in South Africa, we thought that was a good opportunity and complementary approach to use data sources coming from South Africa. And in terms of like whether you can do analysis on one, exactly, that's actually what we are after. The idea is that you would pick whether you'd like to work on a data source coming from the UK or South Africa, and then formulate your research question based on that and carry out the analysis accordingly. I don't know if either Kat or Rosanna, is there anything that you want to add on the top of that?
Yeah, that's all correct, Ekin. I would only add from the mental health side that social finance and ourselves conducted some scoping on data sets in a few geographies, and we were particularly impressed with the quality and depth of the longitudinal data available in South Africa as well.
Brilliant. Thanks so much, Ekin and Kat, and hopefully that answers that question. Moving on to the next one. So there's then a question saying, what if a team has the capacity to apply to the discovery phase, but not the prototyping phase? The application form asks to address both, but actually only 5 of the 10 teams taking part in the discovery phase will progress to the prototyping phase. So I can kick that one off, and then if anyone else wants to chip in, please do. But we've envisaged that the discovery phase feeds into the prototyping phase. So we'll be looking for teams to apply with a view to being able to do both. The reason for that is being able to link the research that people are doing to the digital tool that they would then produce. So in the way that Michael has shared the example use cases, you can see they combine both the research question and the tool. Obviously, in the way that the prize is structured within the prototyping phase, we envisage there would be more of a focus on the groundwork in terms of the research and data analysis, and maybe starting to think about ideating for the tool. The reason that we have structured the prize in that way is there would be a selection process at the end of discovery, which would then assess what research has been done at that point and where have we got to in terms of the ideation for each team on what could be possible for the prototyping phase in terms of the tool idea. So in terms of being eligible for that selection process, we'll be assessing across all the 10 teams to pick the 5 who have the most promising potential to progress to prototyping. But what we'd be looking for is teams to apply collectively, and that's a significant reason why we framed the potential for multidisciplinary teams and collaborations, envisaging that all of those skill sets for both sides might not sit in one organisation. So that's why within the eligibility criteria there's information about lead applicants and co-applicants, so that people can form partnerships to be able to work across the different areas. And one thing that I think we flagged in response to another question is that if people are interested in forming partnerships, we've set up a Slack community group, so that if you wanted to be able to make connections with other prospective applicants or to find specific skill sets that you don't currently have within your organisation, there's also the ability to form those connections via that group. So I think we've already shared that link in the information, or Romana's also shared it in the chat if anyone needs that. So hopefully that answers that question, but please do feel free to put down anything if there's anything else to clarify on that side. But we are very much seeing those as 2 integrated parts. So within the application form, we'd be asking people both for their more concrete plans for the discovery phase and their prospective view on what the prototyping phase and the tool could look like. Moving on to the next question that we've got here. So there's one saying, what do you expect when you refer to involving lived experience, considering that primary research is out of scope? Which is a great question. And I think very much thinking about what's the opportunity to involve young people with lived experience in different ways. So as you say, the anticipation wouldn't be that you're going out and collecting new data and that's feeding into the data analysis, because we're focusing on existing data sets. But what it might be, for example, is engaging with young people in terms of the interpretation and thinking about how can you have support from young people in planning out how you approach your project, or thinking about once you've got findings, how do you nuance that with lived experience. So for example, at the prize level, one of the things that we've done is recruited a youth advisory network, and that's been slightly different, but has been to help us to make decisions about how we run the prize and think about some of the key choices. So it could be, for example, that for some projects that they want a sort of similar advisory network of young people to support on thinking about how they approach their project. We've intentionally left it somewhat broader in terms of exactly how people want to engage lived experience, what would be most relevant or impactful for the particular project, recognising that actually what people apply for might be quite diverse, and therefore depending on the focus of the project, the way that people involve lived experience might be quite different. So we're very open to seeing how people have thought about that. So again, hopefully that sort of gives a sense, but please do ask any other questions on that side. Let me just skim through. I can see one that's just come through in the chat here about what are the existing data sets in South Africa? And Michael, I don't know whether you want to pick that one up or signpost.
Yes, of course. So there's 4 exemplar data sets that we've identified for South Africa. One of them is the National Income Dynamics Study. Another is the Cape Area Panel Study. Both of those data sets are available publicly on the Data First platform. Another one is the Birth to 30 data set, which is a long, well-established set of studies. And finally, the SAPRIN, the South African, the acronym has actually just escaped me, but the SAPRIN team have also developed a novel data set using the most up-to-date data from their studies, which have been made available specifically for use in this prize.
Great, thank you so much, Michael. And then just seeing one other in the chat from Alex, so saying, you're funding data analysis tools, how are you proposing that the active ingredients are implemented in the first place in order to get you the data to analyse spirituality and belief, for example? I wonder, Kat, is that one that you'd be able to kick off answering?
Yes, sure. So ultimately, it's up to the researcher to define the active ingredient and operationalize it in the way that they see fit, and also in a way that utilizes the data that's available. In scoping the data sets that we've included in the prize, we have looked at whether we think it is possible to operationalize active ingredients in those data sets. So it should be possible to do so for a wide range of the ingredients that we have focused on previously. However, it's not necessary to focus on an ingredient that we have highlighted previously or reviewed previously in our commissions. If you want to propose a novel ingredient, that's absolutely fine, as long as it's clearly conceptually defined and is sort of in accordance with the other active ingredients in terms of how it's defined. So conceptually well defined and has a clear mechanistic hypothesized action. So yeah, up to you how you operationalize it. There's quite a lot of freedom there. And in terms of how that relates to your tool, I guess it depends on the research question and the type of tool, but hopefully some of Michael's examples have helped to clarify the sort of thing that you might want to focus on.
Great, thank you so much, Kat. And then I might group 2 together. So one is just the mirror of the question that we just answered about, are there any existing data sets for the UK? And then also a more specific question on, is it possible to propose using older British birth cohorts, for example, 1958 and 1970? Michael or Kat, I don't know whether you'd like to pick up either of those.
The first one about the exemplar data sets from the UK. Again, there's 4 that we've put forward. One of them is ALSPAC, which I believe is the Avon Longitudinal Study of Parents and Children. Another is Next Steps. Another is the Millennium Cohort Study, and finally Understanding Society. But we recognise, as we've said a few times, we recognise that though we've highlighted these 4 data sets in each of these in each of the UK and South Africa, we're absolutely aware that there are others that are appropriate as well, and invite teams to propose those other data sets as well.
In terms of the question on older British birth cohorts, that's an interesting one. So we're interested in roughly sort of up to the age of 30. So I suppose it might be possible to make the case that if you looked at young people historically, then you might be able to use that data. But I think you'd have to make the case quite strongly that the results would still be generalizable to today. I don't know if other panelists have any views on that. Yeah,
that looks like it covers it, Kat. Thank you. I might also share this one with you. So there's another in the chat here about, is there someone within the Wellcome team we could talk to discuss potential active ingredients? Kat or Akin, I don't know whether you're happy to pick that.
So I think so as not to advantage one group over the other. We can't offer support to one team that we're not offering to all teams. However, we do have quite a lot of material out there on active ingredients, and perhaps we can share that as part of the pack that we send out following the webinar, just to make sure that everyone has all the information that's available. But yes, I think we can't offer support to one team that we wouldn't be able to offer to all.
Thanks, Kat. That's really helpful. I'm just looking through questions and checking that we've answered everything from the Q&A. Also, just a flag, if anyone did want to raise their hand, and we can also ask questions live and let you ask your questions that way. So please do feel free to do that. I think in terms of the questions here, there's one additional one that I can see from Daria about, is it possible to look at the range of AIs as in example 1? Do they need to be defined in advance or during the discovery stage? Not sure whether anyone saying Michael would be happy to pick up on that, or whether we need any clarification.
I think it does sound like it would depend on the research question being proposed. I can see, as in the example that I provided, which just said sort of what combinations of active ingredients. I think I can envision research questions that might not have upfront exactly which active ingredients they were going to be looking at, if the data set that was being proposed had such a broad range that it would be possible to sort of cover lots of different ones. I think in that case, the case would have to be made that the data set being proposed has such sufficient breadth across active ingredients that actually it would be possible to pick up sort of the effects across a wide range that didn't need to be specified in advance. I think at the very least, I think in the application we would want some suggestions of, well, these are the active ingredients that we think are represented well in this longitudinal study which we're proposing, rather than just sort of, oh, this is a very broad study, so we'll see what comes out. I hope that answers the question.
Great. Thank you so much, Michael. From looking over the Q&A and the chat, I think that's as many questions as I can see. Maybe one final call if anyone has anything last minute that they want us to cover. Otherwise, if not, I'll hand over to Juliet to wrap up. Can't see anything coming through, so maybe I'll hand back to Juliet.
Thanks, Rosanna, and thank you everyone for your questions. So to conclude our session, I'd just like to remind you about the key dates and resources that you can access. So in terms of dates, so the application deadline is June the 5th. And in order to apply, so you have the link of the application on the Wellcome website that has been shared with you, I think multiple times now in the chat. Then in terms of date, we will let you know by the 24th of June if your team has been shortlisted for the pitch stage of the selection process. And in terms of dates, so the shortlisted team will pitch on the afternoon of either the 5th, 6th, or 7th of July. So please do bookmark these dates if you're looking to apply. And then the first day of the discovery phase will be on August the 8th. In terms of information, so like all the information that we discussed today is accessible on the Wellcome website. And if you want to be up to date and keep up to date about the next event or everything related to the prize, please sign up to the newsletter. The link is also on the page of the Wellcome website. And finally, so Rosanna touched on this already, but for those of you who are interested in participating to the prize but do not have a team already to apply, or if you already have a team but you would be looking for some co-applicants with complementary skill set, I'll invite you to join our Slack channel, where you'll be able to get in contact with other people who are interested in applying. And we'll also be organizing a meet and greet event session to give you also the opportunity to actually meet and speak to other applicants in addition to the Slack channel. So thank you very much, everyone, for your attendance today. And we are very much looking forward to receiving your application. Have a great day, everyone.